Welcome to IPC Training of Trainers video, Session 5, Hand Hygiene. This session will introduce you to the basic concepts of hand hygiene. You will learn about the different types of hand washing, the correct skills to practice when washing hands, and how to improve compliance with hand washing procedures established for healthcare providers in healthcare settings. Hand washing is the process of washing one's hands thoroughly with soap and water for the purpose of making the hands clean, freeing them of infectious germs and viruses, and ensuring that it is safe to touch patients or medical instruments without the threat of transferring infections. It is a top priority IPC intervention which must be encouraged at all times. Appropriate washing and disinfection of hands can be performed using soap and water, waterless antiseptic agents, or if necessary, even ash from wood. The following are the different types of hand washing to be performed by healthcare providers. Routine or social hand washing, antiseptic hand wash, antiseptic hand rub, surgical hand antisepsis. Routine or social hand washing is the technique of washing hands with plain soap or detergent and water. It mechanically removes soil and debris from skin and reduces the number of transient microorganisms. When performing routine hand washing, the following steps should be followed. First, thoroughly wet hands. Then, apply plain soap or detergent. After you have the soap or detergent in your hands, vigorously rub all areas of hands and fingers for 15 seconds, paying close attention to fingernails and the area between the fingers. Rinse both hands thoroughly with clean running water from a tap or bucket. Dry hands with a paper towel, a dry clean personal towel, or an air dryer. Make sure to rinse the tap before closing it and use a paper towel or clean hand towel to close the tap. The antiseptic hand washing technique uses an antimicrobial agent when washing hands with water. Antiseptics are antimicrobial substances that reduce the possibility of infection, sepsis, or putrefaction. It removes soil and debris as well as both transient and resident microorganisms. The procedure is similar to hand washing with soap, except that it involves the use of antimicrobial agent for greater efficiency. Antiseptic hand wash must be used under the following circumstances: before performance of any invasive procedures, when caring for immunocompromised patients such as premature infants or HIV patients, when leaving the room of patients with diseases spread via direct contact. The antiseptic hand rub is a technique where a gel, foam, or liquid containing alcohol is rubbed into the hands as an alternative to washing hands with soap and water. To ensure that the hands are safe and clean, rub the solution vigorously into the hands until hands are dry. The surgical hand rub or antisepsis is a technique that kills both resident and transient microorganisms. It is mostly used in the surgical theatre. When performing this technique, ensure that hands and forearms are washed thoroughly using water and antimicrobial agent or water with plain soap, followed by an alcohol-based surgical scrub product. In order to promote compliance with hand washing hygiene by healthcare providers, the following interventions must be put in place. Reliable hand washing facilities with clean water and soap or hand sanitizers must be available in all treatment areas, waiting rooms, and near toilets for patients and staff. Hand washing facilities and surrounding areas should be cleanable. Hand washing points, which provide portable water, should be signposted accordingly. Hand washing guidelines or standard operating procedures should be available in order to be observed by staff at all times. Staff members should be adequately oriented on hand washing practices. Healthcare workers must wash hands at all critical times, such as before and after eating, after using the toilet, at the beginning and end of every shift, before and after patient care, before and after using gloves, when performing any procedure that involves contact with blood or body fluids, when handling sensitive items such as dressings and used instruments. It is important to note that there are also various alternative safe hand washing practices which can be used in the absence of standard hand hygiene facilities. If bar soap is used, use small bars and soap racks that drain. When no running water is available, use a bucket with a tap that can be turned on and off, or use a bucket and a jug. Remember that despite the effectiveness of gloves in preventing contamination of health workers' hands, gloves do not provide complete protection. Therefore, hand washing must be observed at all critical times. This session has introduced you to the different types of hand washing, the correct hand hygiene skills, and the importance of increasing compliance to hand washing practices by healthcare providers in healthcare settings. As we end this session, it is important to highlight once more that failure to perform appropriate hand hygiene is one of the leading causes of the spread of multi-resistant microorganisms and hospital-acquired infections. So, wash your hands as much as you can.